Good morning, everyone. Thanks so much for joining us today for a talk about interoperability and how important interoperability is to deploying AI successfully in the healthcare enterprise. I'm Chris Meenan. I'm the Chief Product Officer of Blackford Analysis. Um, I've been doing this for a little bit of time. I'm honored to be joined today by Drew Ivan, who's the Chief Architect for Rhapsody. So hopefully we can talk about some of the, I think, really practical things that are happening with deploying AI and how it can help your healthcare organization. As mentioned, I'm the Chief Product Officer for Blackford. Drew is the Chief Architect for Rhapsody. Nothing else to disclose. So I think it's a really exciting time here in RSNA 2024. Even in a few short years, what do we have is almost an explosion of AI modules that are here on the floor. Lots of vendors that are offering really amazing capabilities of AI for clinical practices. You can see there's over 900 AI applications that have been approved for clinical use by the FDA, and healthcare organizations are building their own. So lots of investment still today in building AI. Lots of lots of homegrown things that are being built by innovative healthcare organizations. So there's, I think, some really exciting trends happening right now. I think healthcare systems are moving from a state where it's a situation of does AI work? Can it work? Will it work? To how do I actually optimize AI? How do I integrate it into my clinical workflow? How do I make it easy for my radiologists not to slow them down? How do I make sure that we're tracking it the right way? So there's this, I think, growing realization that as you add more than one AI module or even two AI modules, as you as a healthcare delivery organization are actually starting to think about your own AI strategy and how to make that work, there's this realization that platforms are going to become more and more important to how you do this. So I think integration platforms, interoperability platforms that enable all the things that you want to deliver are really important and a really big part of the story for AI, I think. If you think about all the pieces that your IT team has to take care of to integrate multiple systems, and we'll talk about that. Think about all the security questionnaires that you have to answer, all of the administrative and regulatory and contractual things that you might have to take care of. The interoperability piece plays a big part of that simplification story. I also think that there's an opportunity really to enhance the way that AI performs today, right? We know that there's a tremendous amount of data in the DICOM data, but that you can really enhance the way that the AI is deployed in a health delivery organization if you add clinical data that's not based from the image itself, right? So we're starting to have this discussion around precision orchestration, where you can actually instantiate an AI model based upon not just a standardized, body part and specialty mapping approach, but on a very highly specialized approach based upon patient history or patient age or ordering provider, et cetera. So we know there's significant benefits to adding clinical data to AI. And so the question is, how do you start to do that sort of a thing, right? So most organizations have this view of the world. When you start to think about what's the pie in the sky view of how AI will work, you can see this concept of data flowing from the EHRs or electronic medical record systems, orders and information flowing to the modalities automatically, that information imaging data then flowing to the informatics systems, whether radiology or other informatics systems, diagnostic information and reporting information flowing to platforms, the right AI module launching at the right time for the right type of patient, and then all that AI-based data, new data potentially from AI, flowing naturally back to systems of record, right? So that's the high-level overview. I think when we meet with customers and say, what do you want this to look like? They draw something like this. This is what it really should be. Now I'm going to hand it over to Drew to talk about the realities of this and what it really looks like.
Thank you. Um, when you deploy your first AI module, it looks something like this. You connect your data source directly to the AI algorithm, and it starts running and generating insights. When you deploy your second one, it looks something like this. You do the same thing, only you do it twice. But pretty soon you want to bring in different sources of data besides just the diagnostic modality data. And you find yourself making lots of connections between lots of data systems and lots of algorithms. And you start to end up with quite a chaotic mess. And when you have as many connections as this, there is a solution for it. It might be counterintuitive, but when you have too many systems connecting to too many other systems, the right thing to do is bring in one more system and connect everything to that and turn it into a hub and spoke model. It greatly simplifies the number of connections that you need to make, it standardizes the connections, it centralizes the management and monitoring. It makes everything a lot easier. And this is, whether you're talking about an interoperability platform or an AI platform, it's the same architecture. You need to take many-to-many situation and turn it into a hub and spoke situation. And the benefits here are huge, especially as you start to add in more clinical data sources besides just the image. There's a huge benefit to the AI algorithms by being able to bring in real-time data from the point of care, a longitudinal patient record that contains data from years of history for the patient from many sources. By being able to have this almost virtual model of the patient, by bringing in data from every aspect of their healthcare, you can really level up the abilities, the inputs into the AI modules.
So there's a number of reasons why interoperability is important in AI, right? And we talked about a couple of those things. We know that adding value through systems of record, such as systems like the PACS systems, EHR systems, can actually make it easier to share data with the AI module more effectively, right, and efficiently. So what we hear oftentimes is folks saying, hey, we need to connect, as Drew mentioned, one to many. Different algorithms to different systems, integrate and track all those things. So being able to share data more effectively is really important. There's also, and we already know IT staffs are way overburdened today, and so if you're already busy integrating one or two or hundreds of things, as we showed in the previous slide, adding 20 more AI algorithms can only make that more complicated, so we want to be respectful of that. And basically drive better insights. I think we're at the early stage of getting the value out of AI today. People are, as I mentioned, seeing that it works, it's driving workflow efficiency, but we know AI is generating all sorts of new clinical data. So how do we help share that with systems of record, share that with clinicians, and help other in-house initiatives drive forward from an AI perspective? That's all enabled through interoperability. We know as well that the AI applications themselves are going to continue to need to send new insights back to systems of record. And so how can we do that in a way that doesn't overburden already overburdened staff, if you will? So doing that in an easy way is pretty essential. So maybe I'll hand it back to you.
Thank you. So this slide is a timeline of interoperability milestones, and it's a way of showing how far we've come. In 2009, almost all healthcare records were kept on paper. Electronic medical records had about 10% adoption in hospital space. In 2009, the HITECH Act gave a financial incentive for providers to adopt electronic medical records. And that was followed by some additional programs like Meaningful Use, Stage 1, 2, and 3, that started to set the bar a little bit higher for interoperability. So not only were providers required to capture data electronically, but they were required to be able to share it. And at first, they just had to demonstrate the capability existed in their software. But over time, the bar was raised to be able to exchange different types of data through different standards, and then put some enforcement around actually being able to demonstrate that data was being shared on demand. So what we have here is a 15-year history of gradually increasing the bar on interoperability. And the significance of this is that in 2009, there was no chance to add clinical data to your images in order to improve your AI, because so much data was just captured on paper. In 2024, there's almost no excuse not to add it, because there's an ever-increasing amount and standardization of clinical data that can be easily accessed and incorporated into your AI reasoning. So the landscape today looks a lot different than it did in 2009, and I think that adoption of integrating these types of data sources is lagging behind the capability a little bit. This is obviously a U.S.-centric view of the industry. These are all U.S. policy measures, but other countries are putting similar measures in place that basically say you have to capture certain data about clinical encounters, and you have to make it available for reasons such as using an AI platform. So this slide lists some of the relevant standards that are in use today in healthcare. And the first one is DICOM, which I think everyone here is probably familiar with or perhaps employed because it exists. It's the standard for moving data about images and studies between and among systems. But there are a lot of other standards that are relevant as well. HL7 and FHIR are commonly used for moving electronic health record data around. The IHE profiles give some workflow rules on top of those standards. But there's also standards about the data itself, not just the structure of the messages, but the content of the messages can be coded with different coding systems, like SNOMED CT, LOINC, and dozens of others. So as you start to think about interoperability, you also have to start to think about this diverse set of standards that you may need to grapple with. So the bad news is there's a profusion of standards out there that you have to think about. But the good news is that there are standards. Almost everything that is available in the healthcare ecosystem has a standard that helps you store it or transmit it. And then this is just a slide that shows that not every standard is relevant to every system. There's lots of different types of systems out there that you may want to incorporate the data from, but there's no one standard that you can adopt and get it all in one place. There's a lot of buzz right now about FHIR, and FHIR is certainly a new, modern, go-forward standard that everyone should be thinking about, but it doesn't cover the whole space of everything that's out there that you may want to access. And so it's important to have a versatile toolkit that's able to handle many different types of standards and convert freely among them so that you can get the type of data that you need in the situations where you need it.
Thanks, Drew. So just to summarize a few key concepts for the audience here today, I think, why talk about interoperability? Why talk about how important that is to orchestrating AI, right? So I think, again, for me, we're moving to the next stage of AI adoption, the next curve, if you will, where people are thinking, not just can I integrate one application or one set of applications, but how do I integrate applications securely, centrally, quickly, in a simplified way that doesn't, really impact all of our operations across the hospital. And I think Drew did a great job talking about what it means to be interoperable. It's not just getting one application to work, it's getting applications to work across your enterprise, really, not just radiology stuff potentially, but also other ologies, cardiology, ophthalmology, et cetera. There's all similar initiatives for AI essentially happening in all these areas. So when we talk to CIOs or CTOs saying, how do we do this? I see the industry moving past, does AI work, to how do we do this in a simplified way? And I think interoperability is really key to that. So I think, from my opinion, healthcare systems will continue to adopt AI. This is, I think even a few years ago at RSNA, lots of talks about, is AI here to stay? Is it going to help us or hurt us, or et cetera? Similar to conversations I heard years ago about, is PACS here to stay, right? So those sorts of technologies, I think, now are how we do things. And I think no one saying here at RSNA that I've heard would be crazy to say that we're not going to use AI going forward. The real question is, how do we do that, right? And how do you support it in a way where it's easy for you to adopt, easy for you to integrate? It integrates directly into your clinical workflows. These are all parts of interoperability, right? It's a broad term, but that's why it's so important to where the industry is moving today. I also think that adding non-imaging data to AI will only become more important over time, right? So as I mentioned earlier, things like we want to launch an AI algorithm, not just for all studies, but for certain types of studies, certain types of patients, for patients with a clinical history of whatever that may be. Certain ordering providers may want to have an AI algorithm specifically for a subset of patients. How can AI enhance research initiatives, et cetera? So these are all the sorts of things that we're talking about here at RSNA this year. And I think thinking about how you're going to implement that, how are you going to actually do it, that's why interoperability is so important. And I think that's maybe something I would leave you with as you're thinking about how to integrate these systems at scale across your health delivery systems, maybe moving from a departmental approach to more of an enterprise approach. What's the interoperability aspects of what you're trying to do from an AI perspective? Lots of standards out there that I think are all appropriate and evolving, IHE frameworks, as Drew mentioned. I think these are all part of how you do this the right way, deploying AI the right way in the future. And I think more to come, but hopefully you've seen how important the interoperability is and how important enterprise orchestration is for AI. I think that's all we had to say today. I don't know if you have anything else you wanted to add, Drew?
Nothing further.
Great. Well, thanks so much for your time today. If there's any Q&A, we'd happy to chat about it off to the side here, or our booth, Blackford booth is about a very close walk right back here. So happy, Drew and I can stand there. If there's any questions, we can move from the theater and talk about it as long as you like. So thanks again for the time and attention today, everybody. Have a great RSNA.